important, Dr. Hariton, in terms of why this diversity and this push for enrolling patients from across the country. Why is that important in this study? And some people would say, well, why is it not just the case for all studies, or hasn't that always been the case?
I think it's been important since the beginning of time, but we've just been terrible at it. I think, we used to enroll white males in studies throughout the beginning of the 20th century, and then we used to say, well, this drug works for white males. It must work for Black females. It must work for Hispanic kids. And that's just not true. Everybody's biology is a little bit different. And not even that, our interventions are not always drug. They're sometimes cultural. They're sometimes educational. There's, the weight loss program that works for me is not the weight loss program that works for you. Right. So we have been used to doing research.
No weight loss program is working for me.
I got that. But yeah, I think doing research in a population that is diverse is extremely, extremely important, especially in something like pregnancy. Yeah. From a geographic standpoint, we're going to see waves that are not correlated throughout this country. We saw a wave in the East Coast. We're seeing waves in some states. The East Coast is getting a little bit better. So we're going to have, not only outside of the pregnancy part, we're going to have a study of asymptomatic infections with COVID that changes throughout the country. So understanding how people in different states are affected is very, very important. I think understanding how people of different socioeconomic groups are affected is extremely important. We're seeing from a study in the UK from the NHS that Asians and African Americans, or not African Americans, but Black people in the UK, they're more affected and worse affected by COVID than white people from the UK. And that's after controlling for obesity, after controlling for gender. And why do we think that? Well, perhaps it's because they're more likely to have essential jobs, so they're more likely to get COVID. But it's something else, and something that we need to look at as well. So we are really, really committed to recruiting a diverse group of people, a diverse group of women who are willing to help us answer this question. And I think that, we would be remiss if we went through the traditional avenues of research, of sending questionnaires, of talking to patients at fertility clinics. Fertility clinics, we know that, and it's one of the shortcomings. It's something that you and me work on every day, trying to increase access to fertility care, trying to find affordable ways for low-income women to get access and be able to build their families. It's tens of thousands of dollars, and it's difficult. So the people that we see in our clinics don't necessarily represent the population in America. I'm hoping that when we're having this chat in 15, 20 years, we will have no COVID and we will have a more diverse population. But for now, yes, we can recruit at fertility clinics. We have outstanding partners all over the country who are excited, who understand the importance of this project, but that's not enough. We need to use platforms like this. We need to use social media. If you're listening to this and you are a woman of color or a Hispanic woman or Native American or low income, and you feel like you've been underrepresented research, and you probably had, please join our study, share with your friends, share with your communities. We want you to be part of this study because we care to understand how COVID affects you. And without your help, we cannot do it.
So let's answer right now the big elephants in the room, especially the big elephants in the room for communities of color, which is the word research, the word study makes a lot of people scared. And you add to that pregnancy, and you can see how some people may initially recoil because they're thinking these people want to do research, they want to test things on me and my baby. And given the historical references to some studies that occurred in the past that did involve people of color, I think we need to address the question, the elephant in the room here. So first question, is this safe, and why is it safe?
Well, the important thing to note, and I think you bring up a great point, we have done completely unethical, and by meaning we, I mean the medical community, not you and me. But our ancestors in medicine have done studies that have not been ethical and that have put patients at harm, and that's inexcusable.
Inexcusable.
In this situation, whether we like it or not, we are in a natural experiment, right? COVID is going through our communities. It's going to affect pregnant women, whether we want it or not. Whether the Aspire study launches and helps us get some answers, or we shut it down right now, the women are going to be exposed to the same risks. We would never want to expose them to more risks just to do a study. In this case, this is a prospective, which means that we are studying something going forward, observational study. We're trying to understand what happens if people go about their lives in the same way that they would while they're pregnant. So by testing at home, the finger prick might be a little bit uncomfortable, but in the big scheme of things, it's not a big risk.
Right.
We're asking you to answer questionnaires, and you can do that from the safety of your home on your own time. So we're not really asking people to take drugs or try tests or go to places where they might be worse off. We're allowing people to go about their lives and do what they would have otherwise done, and then just give us the data so that we can find out answers. And I feel like if we were putting people at risk, we wouldn't feel comfortable with it. But I think this is a study that it will benefit women, it will benefit society, it will help providers like you and I go back to the old days where we could provide reassurance and answers and data and really help put women at ease.
And I would tell everyone, full disclosure, I signed my clinic up for this because I read through the study.
We appreciate that so much.
Thank you. And I honestly felt like this study was safe. It was not adding any increased risk to any patient other than just the day-to-day risk that every single one of us is taking right now during a pandemic. Like you said, it's not asking anyone to take any medications. We're not asking you to take not even a vitamin off of this study.
But if you're pregnant, you should take vitamins.
Yes, but you're taking what your doctors recommend, not what this study. We're not studying a drug. For those who are listening, are probably like, yeah, but I bet you some big pharmaceutical company or some vaccine company is behind this. What do you say to that?
There's not. I mean, it's a group of people, a group of clinicians who, we were really helpless. We were seeing this happen around the world. Our patients were knocking on our door and demanding answers. And we said, this is what I know. This is what I can extrapolate from other viruses. And the rest is a black box. And we said, what can we do to make a difference in women's lives? How can we get to the bottom of this? And how can we share that data? Another thing that might be less relevant for our patients, but it was really relevant for our partners, is that this is not something that we're hoping to kind of collect and put on our back pocket. We want this to be an open source database so that our partners can do research. When we finish this study in a couple years and we have this big trove of data that we've collected so meticulously, and someone from a partner, like if Cindy comes to me and she says, I have a question, you guys said this and this, and that's very helpful, but I don't think anybody looked at the mental health burden. I know you guys have some questions. I want to look into that. And we'll say, come right along, let's answer it. This is a database that we're hoping will serve the world, not just UCSF, not just our patients, but everybody. So we are hoping to make that open source so that people with good research ideas can come in and answer them and then publish them to give back to the community and to give back to the patients who are helping us collect this data.
So really what you're saying here, if any given patient of any community is sitting here and saying, I really wish I could find information that informs my community, this is one way you can participate in this study so that you can finally have representation in the data set.
Absolutely. I think that I would encourage anybody from any community to go to the website, read a little more about our study. We have videos that explain what we're asking you to do. We have FAQs that go through every step of the process. They explain to you what we're asking you to do. If you fill out our questionnaire, that doesn't mean that you're automatically enrolled. We have our research coordinators talk to you. We want to make sure that if you enroll in this, you are fully aware. It's what we call informed consent. It's really important that when you join our study, you know what we would like you to do and you're committed to participating. This is not a 1 month commitment. We're hoping a commitment through your pregnancy and through the beginning of your child's life. It's something that you can be proud of. It's something that you can, say, I made a difference. So when we get these answers, you can say, you know what, I was someone who contributed to this study, and yeah, I did not like pricking my finger, but it was worth it because now we know. And Cindy, I think one of the things that we don't talk about is that we're all hoping that pregnancy is good, even protective. Maybe we'll find out that people who are pregnant are less likely to get sick than people who are not pregnant. We don't know, but the uncertainty and the stress that causes on our communities, that is very real. Women who are pregnant in America and around the world today are living at a heightened level of anxiety, at a heightened level of stress, and we don't have the answers to bring them back to baseline. So even if we find nothing, which is what I truly hope we do, that coronavirus does not affect women, that would be amazing. But the ability to tell women that for a fact with real data is huge.
Yes, very, very true.